Hello, and welcome to the Data in-Depth webinar with an in-depth tour of the data tools on our website. My name is Amanda Jovog, and I'm the data lead for the County Health Rankings. I'm joined by my colleague, Karen Odegaard. We'll be introducing the County Health Rankings and Roadmaps, answer your questions throughout today's webinar, as well as sending out some links via the chat box throughout the webinar. First, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Foundation and the University of Wisconsin Population Health Institute. Now we want to take a moment to get you oriented to the technology you're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, where you'll see our screen throughout the presentation. On the right, you can see the control panel. Here, you'll find the handouts for today's sessions, including a PDF of our slides and a list of many of the links that we'll be referencing throughout this webinar. You can also interact with us through the control panel by using the questions section. Please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout our webinar today. We'll be sure to leave time for your questions. You'll also see that we've made this an open webinar so people can see each other's names. Okay. So today, here's what we're going to talk about today. We'll start with an overview of the program and then demonstrate how you can use our site to explore the rankings data. After that, we'll check out a couple of the data tools available on the website, and we'll look at using the rankings data and measuring progress. Oh, I'm sorry, we actually aren't going to be covering measuring progress today. That was a little bit of a holdover. So today we'll cover using the rankings data in depth. Throughout the webinar, we'll head over to the website at countyhealthrankings.org to see how the site functions. You should walk away from today's webinar able to confidently navigate the site. After that, we'll have a Q&A, and after that, we're going to have an after class. There's going to be some resources that we show you in brief. We're going to be going through a lot today that after we're done with our questions and answers, we're going to do live demos of two resources, CDC Wonder and Community Commons, both of which offer a wealth of opportunities to explore our data in more depth and to use our data to make maps. So we hope some of you will be willing to stick around. We like to start our webinars with an essential question for you to hold in your mind throughout the presentation. Today's is, how can the County Health Rankings and Roadmaps help us understand and find data in our communities? We'll revisit this at the end of the webinar. In addition, as we move through this webinar, we'd like to encourage you to think about some reflection questions. So first, who else do you need to share this information with that you'll use or explore? What else do you need to know to take action and use this information? Okay, with this in mind, let's dive into the content of today's webinar. We'll start by reviewing a little bit about the County Health Rankings. This picture shows the underlying approach to the rankings, our theories of change about how the rankings can be a catalyst for action to improve community health for all. We start with population-based data from a variety of sources. Then we use the data to rank the health of nearly every county in the state. Each year, the rankings release generates lots of national, regional, and even local media attention. Community leaders use the rankings release to get the word out to their community and local media, using the findings as an opportunity to mobilize multiple sectors that look further at their community's strengths and needs. Based on a deeper look at their unique priorities, community members identify evidence-informed strategies that can be implemented locally. Over time, these evidence-informed strategies ultimately result in longer, higher quality lives for all the children and adults in the community. Essentially, the County Health Rankings aren't about numbers. They're all about a call to action. The horizontal portion of this picture underpins the rankings. The County Health Rankings show us that where we live matters to our health and that a broad range of factors impact how well and how long we live. The vertical portion of this underpins the roadmaps. The roadmaps offer communities guidance, tools, and resources to move from awareness to action to create healthier places to live, learn, work, and play. With this in mind, let's take a deeper look at the rankings part of this picture. So this is one of the most important images we'll share with you today because it shows what we use to determine the county health rankings and what influences health in a community. This model shows the relationship between policy, health factors, and health outcomes. It illustrates the multiple factors that impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks, the quality of our schools, availability of jobs, access to healthy food, clean air and water, and our social connectedness all impact our health. So we know from the research that effective policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors, the blue boxes here, shape our community's health outcomes. We specifically look in our rankings at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes in green boxes to show how healthy each community is, the length of life and the quality of life. Our rankings of health outcomes are essentially a ranking of today's health, and our rankings of health factors, the things that predict health outcomes, are a ranking kind of tomorrow's health, the health we can envision in the future. Because much of what affects our health happens beyond medical care, this model and the rankings that are based on it underscore how important it is to build a culture of health, where getting healthy, staying healthy, and making sure our kids grow up healthy are top priorities. Having looked at the model, now we're going to turn our attention to the website, countyhealthrankings.org. For today's webinar, we'll be going through the Using the Rankings data tool that can be accessed via the County Health Rankings homepage. You can see here in the pull-down box from Health Rankings, you can get to the Using the Rankings data tool. This tool, which was entirely revamped for the 2015 release, can guide you and your community on how to make the most of your snapshot, the data within, and the additional data tools and resources available on our website. In this tool, there are 7 sections that are listed here. I'm going to just briefly walk through what each section contains. Communities using the rankings data introduces us to some of the ways in which communities are using data. Exploring the data orients communities to their snapshot and introduces the tools available. Making use of your snapshot guides communities in asking the questions and making the comparisons necessary to turn the data in their snapshot into usable information. Digging deeper prompts communities to explore a few measures in detail and provides information about finding subgroup and sub-county data for specific measures. We know that the ranking snapshots are just a starting point in exploring the health status of a community. Broaden your view, ask questions to lead communities to other measures that might give them more information for their work. Visualizing the data provides you with resources for illustrating your data on maps, and finding more data provides some national links for where to find more information and directs you to state-specific collections of data maintained on our website. We're going to go through all of these areas briefly in a process of exploring one community snapshot. So the first question we're going to ask is, why should communities even bother with data at all? Communities are using data for a variety of purposes. They use it to engage communities in health improvement. The rankings offer a way to begin the discussion when it comes to community health. The next step is getting moving. They assess the health of a community. Communities across the country are incorporating county health rankings data into community health needs assessments and improvement processes and other health improvement strategies. It can identify the root causes of health issues. The county health rankings are used to uncover the root causes of poor health in the community and to focus efforts on factors that can lead to the biggest gains in health. It can support decision-making and policy change. Data and support from the county health rankings and roadmaps are used to inform policy and decision-making in support of actions to improve health. And it can track progress. As communities take action, they've used data from the rankings and other sources to understand whether programs, policies, or plans are on track to improve. So now we're going to, I'm sure your communities have used this data in a variety of ways. We're going to take two quick polls here where we ask you what have been the most successful uses of data in your community and what have been the most challenging. First, we're going to ask which way of using data has been most successful in your communities, and you can choose one of the 5 ways that I just outlined. I think we're going to take a few seconds. We'd like to get about 70, this is a rapid response poll. We'd like to get about 75% of respondents having answered. So we're going to give you half a minute to get this poll done. So everybody go ahead and start answering.
Great, thanks Amanda. This is Karen chiming in. We're going to watch for the results to come in here. We've got folks diving right in, looking at the questions, so we'll give you all just a few seconds more, and then we'll see what you're coming up with.
There definitely appear to be some higher and some lower answers coming in. It's not too close.
Yeah. All right, we'll go ahead and we'll close the poll and take a look at the results.
Mm-hmm.
So we can see that assessing the health of a community is clearly sort of in the lead here of what communities feel they've been most successful at.
Yeah, that does seem to be the biggest thing. That's not a huge surprise. When we work with communities, we see that places are using the rankings to assess the health of their communities for community health needs assessments, for community health improvement planning processes. We know that that's a major usage of data throughout the nation.
I would say, too, that I think while we see that a lot of communities have been successful here, you can tell from the poll that others didn't identify this as an area of success. So, we like to look at our webinars as a way for communities to share their successes and their the lessons learned with others. So if you have used data to assess the health of your community in a way that you think has been really powerful, in a way that you think you've had quite a bit of success with, feel free to chat that in using that question box, and we'll share that with others on the webinar as well, just to again share your expertise in using data with others on the webinar. Do you want to move to the next poll? All right, we're going to hide this one and pop up the next poll to hear a little bit more about which ways of using data has been most challenging.
So once again, if you can just identify one of the 5 ways here where you think data usage has been a challenge in your community, where you think you could use a little more help, a little more assistance. We'd love to hear that, and we're hoping that this webinar will really help you in your process of understanding better ways of using this data. Well, we're getting a lot of votes. This is a lot closer than the other poll was, actually. I know that when I work with communities, there's definitely ways that they feel more comfortable and ways in which they feel like it doesn't quite click yet. It's not, they're not quite sure how to turn this data into something useful in their communities, into something that measures what they've been working on, how to dig in and really find out where the things they're worried about are happening.
All right, I think we can close this poll and take a look at the results here. So we see 3 key areas, I think, where folks have found some challenges. This idea of engaging communities in health improvement, identifying the root causes of health issues, and supporting decision-making and policy change. And I think, I think a lot of what we'll be talking about today, Amanda, will help people get a sense of how they might use data in these ways, especially I think this idea of engaging communities in health improvement, where it's really about translating data from being just a number to something that's much more meaningful. And once you're able to do that, I think that also really helps in thinking about that one of those other challenge areas that's supporting decision-making and policy change. When you make that data more meaningful and you put some context and some story behind it, that can help use that data to make changes. So yeah, I think, and then Amanda is going to also talk about some ways that you can dig into the data a little bit more deeply. So I think that can help us, or help those of you who are thinking about ways to identify root causes of health issues as well. Again, I would say if you feel like your community has had success in any of those challenge areas, we'd love to hear about it. So feel free to chat those in, and we'll either share them out via the chat box with everybody or bring them into the conversation as it makes sense. All right, thanks, Amanda.
Okay, so welcome back. Thanks for participating in that poll. Exploring the data. Okay, for the rest of this webinar, we're going to be going to, well, not for the entirety of this webinar, we will be going for a while now to the live website, and for the rest of this webinar, we will be using Spartanburg County, South Carolina as an example, a place where you can really explore and dig into their snapshot a little bit. Spartanburg was a recent winner of the RWJF Culture of Health Prize, and you can find more information about their story at rwjf.org. Okay, so I'm going to pop over to the live site now. Okay, so here we see the front page of the countyhealthrankings.org. If you go down to the map, there are several ways actually to get in and find your community. You can use the search box here and type in your community. You can also do that here, or you can click on the map. I'm going to click on the map here and get to South Carolina. So you can see here that there are two maps here. The green is rankings in health outcomes, and on the right is rankings in health factors. You can see that the lighter, more lightly shaded counties are the higher ranked counties, have better health outcomes or better health factors, and the more deeply shaded counties are the lower shaded counties, the ones that have more challenges in health outcomes or health factors within the state. If you scroll down, you can see some resources, some of which we'll be revisiting later on in this tour, okay? But I'm going to go up here. You can click on the map and go to a county, but I'm going to go up here and get to Spartanburg. So in Spartanburg County, you see a host of resources available to you at on your website. So in 2015, Spartanburg County ranked 17th out of 46 counties for health outcomes and 10th for health factors. It's not the best in the state, but it was in the top half. Your snapshot contains 4 columns of data, kind of 5, but 4 that actually have numbers in them. Oh, let's get out of that search. And you can see here that we have the rates for Spartanburg County as a whole, the rates of each of our measures. We also have an error margin. That gives us some sense of how reliable we feel this measure is. This is the 95% confidence interval. We have a measure here, the top U.S. performers. Those are the 90th percentile of counties, the best 10th percent, the ones for whom only 10% have a better value. And then we have the state value. These provide comparisons to use for your snapshot. In addition to that, we have a column of trends where you can explore how these measures have been changing over time. We also have a tool called Areas to Explore, which we'll get into a lot deeper later in the webinar. In addition to the county snapshot, we have additional measures. These measures are measures of demographics that we don't rank on because there's no particular better value or worse value here, just information for you to help understand the context of your community. Some additional measures in health outcomes, health behaviors, all of our areas. Some of these can be very useful measures that we'll come back and revisit again and talk about using your snapshot. In addition to, well, let's actually look at one measure, okay? So in premature death, if we click on that, we can see a map of South Carolina again, and we see that a county like Marion has a particularly high rate of premature death, and a county like Beaufort has a particularly low or good value in premature death. In addition to that, you get some information on where this measure lies in our rankings, how much weight we give it, what years we used, the range of the values in the state value, and the top 10th percentile again. In addition to the map, you can also see a data table that includes a little more information than just the overall rate. It often includes a numerator or a denominator. You can again see the trends and the error margin. You can also see the z-scores that we use to calculate your rankings. In our description for each measure, you'll get a lot of information, such as a much more in-depth description of the measure, often directing you exactly how you should calculate it if you'd like to duplicate these measures. A little information about that measure's connection to health or why it's an important health outcome, our reason for ranking it, and then we have measure strengths and limitations that gives you some of the reasons, again, that we use that measure, but also can give you some indications of the limitations of those measures. These are pretty important, and you should feel free to look at those. We also provide data sources where you can get information on how to download the data and some more information about the methodology used to measure each measure. So that's a really quick tour of the snapshot. In addition to that, we have downloads that are available for each state. This is where you get to the state downloads. It includes all the information, the maps for the state as a whole, and the data is available as an Excel download. You can also compare counties. We do provide, again, on the snapshot, a comparison to the state as a whole, but perhaps there's a neighboring county who it's particularly useful for you to compare to, or a county who's similar to you in some ways, and you can add all the counties within South Carolina that you'd like in order to compare your measures. And all of these can provide very useful tools. So this was a pretty quick tour of our webinar, but we've got a lot of information to cover to help us figure out how to use this, and we'll be returning to this snapshot again. Okay, so next we're going to talk about how to make use of this snapshot. Perhaps your goal here is to engage your community in health improvement. You can use your snapshot to assess the health of communities and identify areas where you'd like to focus and engage your community. Making use of your snapshot can really help with that. How do you do that? How do we do that? We make it easy to make comparisons to state and national values. We make it easy to examine trends, and we help you to focus on important measures. How do we do this? So let's take a closer look again at Spartanburg County. First, we're going to focus on the health outcomes. We might ask ourselves, how does my county rank, and how do my county's measures compare to state averages, to the top U.S. performers? It appears that Spartanburg County ranks relatively high in South Carolina in length of life, but ranks right in the middle for quality of life. All of their measures here are either right on par with South Carolina, more or less the same value, or just slightly worse. So we can see that Spartanburg County is kind of an average county within South Carolina for its health outcomes. Okay. Next, let's take a look at health factors. We can see that overall, Spartanburg County is doing better than most counties in South Carolina with a rank of 10th out of 46. However, this overall rank can mask some important areas potentially in need of improvement. Spartanburg County appears to have relatively good access to and quality of health care, with a ranking of 17. Okay, but it's worse than average in the physical environment with a ranking of 35. Both health behaviors and the social and economic factors appear relatively good within South Carolina. They rank 12th and 11th, respectively. These two areas have the most substantial impact on the overall health of communities, as we identified in the model. The rank health behaviors have a weight of 30%, and social and economic factors a weight of 40%. So they compromise 70% of the health factors overall. Earlier in the webinar, we noted that health factors can be viewed as a ranking of tomorrow's health. With higher rankings in both health behaviors and social and economic factors, Spartanburg County appears poised for improvements in health outcomes if these patterns remain unchanged. Looking at health behaviors, we can see a higher than average teen birth rate of 51 when compared to a state rate of 46, both of which are substantially higher than the top U.S. performers. Within clinical care, we see a higher rate of preventable hospital stays, 64 compared to 54 for South Carolina as a whole. Within social and economic factors, while most indicators look around typical for the state, the rate of people with at least some college education appears low compared to the state as a whole. And finally, within the physical environment, we see a higher than average air pollution and driving alone to work. I'll just note here that all of the measures that I pointed out here that actually have error margins, not all of our measures do have error margins associated with them. The error margins didn't overlap with the state values, so we can assume that these differences are real rather than kind of statistical variation that sometimes happen. We can have more confidence that these differences are real differences. Now let's turn on areas to explore. Let's pretend I clicked that little button that at the top of the screen earlier. You can see that smoking, obesity, the rate of uninsured, preventable hospital stays, high school graduation, income inequality, and violent crime are all highlighted as areas where communities might want to take a closer look. Our approach to flagging areas to explore considers not only the comparison with the state average, but also a comparison with the national standard and the overall weight of a measure within our algorithm. For example, since smoking and obesity affect the health of so many Americans, most counties will need to keep these measures in focus. So uninsured and all of the highlighted social and economic factors were not identified as potential problems at first glance when we just took a look at the snapshot without the areas to explore. This is likely due to the fact that sometimes the state average is not the only comparison to consider. In these cases, it appears that even average counties in South Carolina have problematic rates when compared to the rest of the country. In addition to areas to explore, trend maps provide useful information for identifying problematic measures or finding areas where progress is being made. We're going to take a look at a few of the trend maps within Spartanburg County. First, we'll look at children in poverty, one of the two trends that are worsening in Spartanburg County. The Spartanburg value is in blue, South Carolina in green, and the U.S. in red. You can see here that the rate of children in poverty has been increasing over the past 10 years in Spartanburg County. In 2006, 7, and 8, Spartanburg had rates of children in poverty that were comparable to the U.S. values, but it has since risen to be equivalent with the higher South Carolina value. Now let's take a look at violent crime. Violent crime was identified as an area to explore, but also has an improving trend. So again, let's note Spartanburg County's in blue, South Carolina in green, and the United States in red. Violent crime in Spartanburg County has decreased by almost 1/3 in the past 10 years, approaching the national average. This suggests that the work going on in the county is on the right track and should continue. Now I'd like to take a look at the trend graph for the uninsured. Uninsured was identified as an area to explore in the snapshot, and the trend graph noted no change. We see here that the rate for the uninsured in Spartanburg, the blue line, has not changed since 2006 and is very close to the South Carolina average, which is shown in green. Okay. Based on our exploration of Spartanburg snapshot, there are a number of candidates for measures we might want to explore more deeply. For the rest of this webinar, let's take a look at teen births, which we identified as being higher than South Carolina as a whole, and the rate of uninsured. Now, let's think again about communities' uses of data. Why would we need to dig deeper into these measures? It might be to understand the root causes of problems. If these problems are located primarily within one demographic group or in one small area, it might give us some clue about why it's happening. Another reason might be to build evidence for programs and policies. It's important to target programs and policies to ensure they will affect the populations or neighborhoods where help is most needed. So what kinds of questions might we ask to dig deeper? First, we might be interested in how this measure varies between population groups. Does this measure differ across age groups? Does it vary among racial or ethnic groups? Does it vary across groups with different social and economic characteristics? We also might wonder if there are areas of our county where these problems are concentrated. Are there specific zip codes, neighborhoods, or school districts where the measure indicates a localized problem or an opportunity? In 2005, we added a new resource to help communities with this process of finding answers to these questions. Digging Deeper provides you with a table that summarizes our understanding of the national availability of subgroup or subcounty data for each measure. For each demographic group and for local areas, you will find a yes, a no, or an NA. A yes does not mean that there is subgroup data available for every county, but rather indicates that for at least some counties, subgroup data should be available. In some cases, the data is generally available from state-specific sources or is only available for larger counties, or some modifications must be made to the measure to get subgroup data. Click on the measure name to get more specific information about how to access subgroup data and what limitations you might encounter. A no indicates that county health ranking staff are not aware of any sources of data for these demographic groups or sub-county areas. NAs represent a cell that is not applicable. You'll generally find this where we are measuring the availability of a shared resource. For example, everyone in a shared geographic area has the same access to air pollution. It wouldn't make sense to estimate different air pollution levels for different demographic groups living in the same geographic area. Okay. At this point, we're going to take a look at the two measures that we identified, teen births and the uninsured. We can see here that for both of them, there are a number of areas where we believe there is data available for teen births. We can get that by age, by gender, by race, by education. And for the uninsured, we can get information by age, by gender, and by income. And there might be some other resources available, but this is the ones we were aware of at this time. So when we click on a measure name, we get more information about what exactly is available. For teen births, we see that county-level data are available for counties with populations of 100,000 persons or more on CDC Wonder. You can stratify by the age, race, or education of the mother, among other variables. For the uninsured, on the website, the SAHI website, which is where we get our data, you can stratify by age, gender, and population ratios. In addition, the Community Commons Health Equity Assessment Report provides you with information by age, gender, race, and provides a census tract. You do need to log into this website in order to access these reports. We're going to take a look at what finding this information looks like. Okay, so for teen births, I'm going to offer you a few screenshots of the resource you could use to explore these measures. However, if you're interested in seeing me navigate these resources live, CDC Wonder that is, and to learn a little more about what you can do with it, please stick around for the after class. We're going to spend about 15 minutes with CDC Wonder and take some questions if you want to learn more. CDC Wonder is a powerful tool. I'm actually going to show the front page now. So, this is actually the results, but it's okay. CDC Wonder is a powerful tool to explore birth and death data in counties nationwide. Please note there are a number of suppression criteria on this website that could prove challenging in accessing data for small counties, but for medium and large counties, there's a wealth of information here. In the case of Spartanburg County, we can use this website to take a closer look at birth rates. So first, let's examine the trends in rates over the past few years. Rankings data for teen births are combined for 7-year rates to ensure nationwide coverage. But for many counties, single-year data is available on CDC Wonder and can be useful in exploring change over time. We can see that for Spartanburg County, the highest teen birth rate was in 2008 at 10.6. But it's since fallen dramatically, almost being cut in half by 2013 at then 5.56 teen births per 1,000. Now you might want to explore if these gains have been experienced equally among different racial groups. CDC Wonder lets you do that. This table shows the rates over time for Black or African American, white, and for some years Asian or Pacific Islander mothers. The reason that the Asian or Pacific Islander group is shown only in some years is that CDC Wonder suppresses birth rates when there are fewer than 10 births in a given time period for privacy reasons. We can see here that the highest rate for Black or African American mothers was 16.62 in 2009. And for white mothers was in 2008 at 9.06. Rates among both groups had fallen by 2013, with rates for white mothers down to 5.31. The reduction for Black or African American mothers was more than half the high rate at 6.71 in 2013. The rates are now getting substantially closer to equal in Spartanburg County. Okay, so now let's take a closer look at the rate of uninsured in Spartanburg County. I noted in the Digging Deeper paragraph, you can create a health equity assessment report about the uninsured status at Community Commons. So I'm going to briefly walk through this report for you. This is something I was able to get off the website. Oops, now, of course, it's taken a minute to load it up here. But this resource, you can even see from the front page. Oh, here it comes now. We're going to get information on the rate of uninsured. First, we can see it Spartanburg County, South Carolina, the United States. We can get a map of the rate of uninsured by tract, by census tract, and we can see areas where it's particularly high or particularly low in Spartanburg County. We can see the rate of uninsured by gender. We can also see the rate by race, but I, for some reason, seem like I can't open this document. But if normally this document opens, and you can see other tables that show it by race, by Hispanic ethnicity, and over time. So this is a great resource to try, and we will go and do this live later in the after class. We're going to be exploring Community Commons in addition to CDC Wonder. So please stick around if this is a resource that you're really interested in. Okay, now that we look closely at how a handful of measures are affecting your community, it might be time to broaden your view. The ranking snapshot is just a starting point in understanding health in your community. We carefully select a limited set of indicators that provide a clear and concise overview of health in communities. However, there are a host of other indicators that one might want to consider when focusing your work on a few areas. The Broaden Your View section here offers suggestions about questions you might want to ask based on the health factor areas you're focusing on. Sometimes these questions will point you to subgroups often at risk. Sometimes they'll point you to adjustments to our measures that might prove useful to examine. Sometimes they'll point you to other indicators you should explore. The rankings make every effort to include the indicators that matter most across the country, but there may be other important health factors or indicators or measures of health in your community that we don't touch on or cover fully. You can see here, for example, if you found that the rate of drinking and driving was higher, alcohol-impaired driving deaths was high in your community, you might want to ask, well, are people being cited for operating while intoxicated? In social and economic factors, you might want to, if you're looking at unemployment, you might want to ask also not only how many people are unemployed, but how many are underemployed? In clinical care, if you're thinking about dentists, the supply of dentists in your community, you might think, well, what percentage of the population has been able to see a dentist in the past year? And for the physical environment, perhaps air quality is a real problem in your community. Well, which air pollutants are the ones that are causing most of the air quality problems? Or what are your community's policies about building bike lanes and paths, which might change air quality, or your driving policies in your county? Hopefully you can find some of this information in additional measures or some of the other national resources that we'll be pointing out will have some of the supplemental data that might help you answer these questions. Let's move on to visualizing your data. Sometimes a picture's worth 1,000 words. As you're trying to engage interest in a health topic in your community, it might be useful to use some of these tools to help you tell the story. On our website, you'll find a number of mapping resources, but I'm going to highlight just a few now. Mapping the Meal Gap is a resource we use to gather information on food insecurity, but they also provide some nice maps at the county or congressional district level about food insecurity for adults or children. Oops, we can't quite see this. Oh, and I can't fix it right now, but there's another resource called Esri Story Maps that are a collection of sophisticated data visualizations made by ArcGIS software users that illustrate data on maps and also surround those visualizations with stories. There's a number of health-related maps on this site that might be useful. The U.S. Health Map, which again, you're just going to be able to see a tiny bit of. I'm not sure why this other one is covering it up. But it's a tool from the Institute for Health Metrics and Evaluation that shows measures of health behaviors and life expectancy at the county level throughout the United States. These resources, we put all of these into the links that are included in the handouts. We also included some tips about how to make them more useful. So please go grab that handout and check out these resources for yourself. In addition, there are some other resources that not only provide county-level data, but can give you data at several different levels. WalkScore is a resource that shows you the walkability of various neighborhoods or cities. You can map your own address and find out the WalkScore for your house. It can provide some really beautiful maps that illustrate the walkability of your community. There's also Bike Score that you can use to do something similar for biking in your community. As I mentioned before, Community Commons, they not only are a provider of health reports, but can make it really easy to map a huge, huge database of data. They give you ideas that other communities are doing. You can see here that they have stories all along the bottom of their website and examples of ways other places are using their data. And you can go on there and map this data. In fact, that's what we're going to do in our after class. So stick around if that's something you're interested in. Okay, so finally, let me share with you a few resources to help you find more data. So the Rural Health Assistance Center has compiled an extensive list of resources and tools relative to exploring health in smaller geographic areas of the nation. Really, pretty much anything you need you're going to find on this list. It's really remarkable. Many of the data sources used in the county health rankings can be found here, as well as really a plethora of others. The Community Health Status Indicators 2015, which you'll see kind of an output here, is an interactive web application that produces health profiles for all 3,143 counties or county equivalents in the U.S. Each profile includes key indicators of health outcomes which describe the population health status of a county and factors have health outcomes such as healthcare access and quality, health behaviors, factors, and the physical environment. They lay out their snapshot is a little different. You can see here that they kind of put their measures into different quartiles, so you can see really at a glance which measures your community might be struggling with and which measures your community might be really strong in. It's a very useful complement to the county health rankings. In addition to national websites, the rankings team has compiled data sources from all 50 states that provide more information about our health factors, and many of which provide information about specific population subgroups or focus in on smaller geographic areas and counties. You can see that for South Carolina, we've included a wide variety of data sources, from communicable disease reports to public instruction data and statistics. So at this point, we've taken you through the process of exploring the different areas of a snapshot, to exploring measures in detail, to going outside of the rankings website to answer questions spurred by your data. I know this has been kind of a whirlwind tour, probably a little bit overwhelming, but I'm hoping that there's something here that sparked your interest, and if there is, that you can spend a little time using the rankings data tool. Interested to stay for the after class, where we're going to learn a little bit more about the two important data sources I mentioned earlier, CDC Wonder and Community Commons. Okay, I'm going to turn this over to Karen so we can move into questions and prepare for our after class.
Great, thank you, Amanda. I wanted to go back to our reflection questions that we posed at the earlier in the webinar, just to help you start thinking about what questions you might have. And so thinking about who else do you need to share this information with, what's one area of the website that you will use or explore, one area of this specific tool using the rankings data that you know you want to go back and dig into, and what else do you need to know to take action and use this information. So we have a handful of questions here, Amanda, and I'm going to start with one from Pamela asking, is there a lag in the county health rankings data compared to the data that states have? Can you just talk a little bit about that data lag that sometimes folks have questions about?
Sure, I'd be happy to. We generally use, well, we always use the most recently available national data. In most cases, for most of our measures, that is likely to also be the most recently available data to states. I can think of a few cases. I know that in graduation rate data, that is oftentimes available at, like you might get one more school year than we are able to get nationally, because some states have slower reporting times than others. There might be a few others. Unemployment is often available to counties at a little more recent than we published, because we publish annual averages. Those are the ones that really strike me as being where sometimes there's more recent data, and we certainly encourage communities to use whatever is the most helpful data to them at the time when they're doing their assessment or their priority setting.
Great, thank you. And Nancy had a couple of questions about rural counties. So specifically, she's wondering whether we here at County Health Rankings and Roadmaps group data for rural counties, and how do we treat counties with small numbers, with small population sizes?
Sure, that's a great question. Working with rural health data is tricky. We don't group rural counties. In part, that's because we often don't know enough about rural counties to make the right groupings. Sometimes communities that are even right next to each other are very different from each other for a variety of reasons that we can't pick up in our data. So we've chosen not to make groupings of counties as a general practice. In order to access data for rural counties, we try to find places that either make it possible for us to use multiple years of data, which oftentimes gives us enough information to produce estimates. Sometimes we use data that is modeled so that it can predict measures, even when it might not be easily available without the modeling. Those are probably the two ways in which we try to provide data for rural counties when it's not always easily available.
Great. does the County Health Rankings provide any specific data about substance abuse or mental health at the county level? I know lots of folks or lots of communities are working on those issues and good sources for data.
Sure. Boy, it is really, I used to work in alcohol and drug abuse services, and let me tell you, it's really hard to get that drug or illicit drug use data at the county level. We do provide a resource in additional measures of drug use deaths. These are drug use deaths that were caused by overdoses or long-term usage of illicit drugs or prescription drugs, actually. So hopefully that resource would be available to places. We don't include that as a ranked measure at this point because there are so many counties that we can't get it for. There's just not enough deaths for the suppression criteria to work out. So, but for a number of probably about 2,000 counties, actually, you can access that data in additional measures. For mental health data, we do provide county-level data, number of mental health professionals in your community, and we provide information on the number of mentally unhealthy days that people report experiencing in our health outcomes. So hopefully those two measures can give you a little information about those two topics.
Great, thanks, Amanda. I know a lot of folks on the webinar are wondering if you can talk a little bit about what's new with the 2016 rankings. Are we ready to talk about that yet?
No, we're not quite ready to talk about that, but as usual, we'll be putting on a webinar before the release. You can expect it in late February. We'll be putting up the date sometime soon, and you can find out all the new tools and resources we'll be producing on our website this year, and we're very excited to share that with you. Please, please keep an eye out in your email inbox or on our website.
All right, thanks, Amanda. I'm watching the clock here, and I think we probably want to start wrapping up and make that transition into the after-class demonstration. So thank you to everyone for your questions, and we'd like to remind folks that we do, as Amanda just kind of hinted at, we do have upcoming webinars. You can register for those upcoming webinars on our website. I'm going to drop a link in to the chat box right now so you can connect, excuse my coughing, you can connect with us on those upcoming webinars. We also like to remind you how you can stay connected with us. We are on Twitter at CH Rankings. You can like us on Facebook, and definitely if you're not already subscribed to our e-newsletter, it's a great way to find out about upcoming webinars and other news coming out of County Health Rankings and roadmaps. So we'd like to remind you about that e-newsletter. And as always, we like to acknowledge the number of partners and colleagues that we work with every day to make the County Health Rankings and roadmaps a reality. So lots of folks involved here in making this project a success.